Happy Friday, everybody. It is good to be back here on Fridays. Last Friday was obviously the Thanksgiving weekend, and so we did not have any procedures because we were closed, but we're back. It's Friday, and we have a really great case today. So our case today, we just have one because it's a little bit of a bigger case, but I'm really excited to help this gentleman out. We are doing an adipose and bone marrow stem cell procedure for 3 areas. The main thing that he wants to treat is actually his wrist. Then we're also going to do his low back and a little bit in his neck. He has a few areas in the low back and the neck that we're going to address while we're already addressing the wrist. And the way that I think about this is that there's not enough. It's not like there's a whole bunch of stuff going on in the neck and the low back that I think it's greatly going to take away from the healing in his wrist, and so we've decided to add that in. It's going to be a good one. I'm super excited for it. It's a great day here. It's chilly, but I love it. We got in the cold plunge this morning, and I'm excited. I hope you guys enjoy this episode. Let's get it going here. All right, everybody, so we just finished up our procedure for the day, Fridays here at RP. So today's procedure was a lipoaspirate, so an adipose, bone marrow stem cell procedure. So we combined both of these therapies in order to help our patient with neck pain, low back pain, but most importantly, wrist pain. This patient has a history of a fractured radius that he had surgically repaired many years ago. And one of the unfortunate things that sometimes happens when we have large injuries to joints is that they become osteoarthritic a lot faster. So it's well known that an injury to a joint can cause osteoarthritis to progress at a hastened rate compared to other areas in the body. And so because of the severe trauma and injury that he had to his wrist, he's now developed some pretty significant osteoarthritis in the wrist that we decided to treat with our regenerative injection therapies. And so our injections today were pretty extensive. So in the low back, we mainly treated the sacroiliac joints, and we also did a caudal epidural. The sacroiliac joints were treated with bone marrow and adipose. The epidural was the marrow adipose tissue. So in the bone marrow separation, we can actually collect some adipose that has stem cells in it. And so we use that along with some adipose for the caudal epidural to help with some potential nerve root irritation that he's having in that region, with maybe some discogenic pain. That was a little unclear from physical exam because his sacroiliac joints were bothering him so much that it was kind of clouding our judgment there. And then we treated the supraspinous and the interspinous ligaments, and he actually had on imaging findings of some edema within the L2, L3 supraspinous ligament, and so that was contributing to some of his pain on physical exam as well, so we treated that. In the neck, very straightforward case. The patient had facet syndrome on the right side, so pain got worse when he looked up, and then when he looked over his shoulder as well. And then all of our physical exam findings supported that facet syndrome of the cervical facet joint. So those are really straightforward. The wrist was definitely more complicated of a case because we had just very large, diffuse, scattered degeneration, not just within the joints in the wrist, but the ligaments, and then also some of the tendons that run over the wrist and that are going to attach onto the fingers and things like that. And so our approach today was we try to be all-encompassing, but not go too hard on the actual injections, because we didn't want his wrist to swell, balloon up, and it be a huge hot mess for, a week, things like that. We tried to keep our injection volumes low, but really concentrated so that we could get some better outcomes. But because of the degeneration, bone marrow edema that he had in the capitate bone, we actually decided to do an intraosseous injection of bone marrow into the capitate bone. So under ultrasound guidance, we found the location that we wanted to inject based off what our MRI and our CT showed for the optimal location to enter into the bone. And then we injected a very small amount of concentrated bone marrow inside that bone, and then injected bone marrow and adipose outside around that to try and help, obviously, with the healing of the bone, because we just put a needle inside the bone and we want that bone to heal as well. And then from there, we treated most of the joints in the wrist. So we had the distal radial ulnar joint, we had the proximal, radiocarpal joint. Then we also had the midcarpal joint, which we actually needed to inject a few different areas. So normally with the midcarpal joint, you can kind of inject one area and it will spread throughout. However, because of his past injury and the surgery that he has a lot of scar tissue. And so we couldn't be 100% certain that if we injected into, for example, the scapholunate joint, that we would actually get spread within the entire midcarpal row. And so we decided to inject throughout. So we did the triscaphe joint, we did the capitate lunate joint, we did the scapholunate joint, all in an effort to try and get these tissues to improve their integrity a little bit, whether we call that regeneration or whatever we call it. But the biggest thing is reduction in pain and an improvement in his ability to get through life with that wrist so that it doesn't kind of hinder him. So that was our day. It was a really great day. Things went super, super well. I hope you guys enjoyed this week's episode, and we will see you all next week.